Last year's enrollment hit record numbers, 15.7 million. And this year's enrollment is expected to exceed that rate. We're already at record highs for ACA Marketplace registration. And we've actually had record highs for several years in a row, said Cynthia Cox, KFF Vice President and ACA Program Director. A big part of this was due to increased subsidies. The pandemic may also have encouraged more people to buy or maintain health insurance. There are several factors that could increase enrollment this year, including ongoing disenrollment of beneficiaries from Medicaid, new enrollment mechanisms established through health.gov, and greater involvement from insurance companies. Flexible timelines. The Centers for Medicare and Medicaid Services created a temporary Medicaid relaxation special enrollment period this year in anticipation of widespread disenrollment. This special registration period started on March 31. According to KFF, more than 10 million people have been disenrolled from Medicaid since the relaxation period began. Many are still considered eligible for Medicaid, but they may have been excluded due to administrative issues such as an incomplete address or failure to complete required paperwork. A relatively small portion of these people switch to Marketplace, because a lot of people who lose Medicaid do so for procedural reasons, Cox said. So if they reapply for Medicaid, they may find that they're still eligible for Medicaid. In addition, some people are losing coverage, especially if they've lost their eligibility for Medicaid coverage. That's because, got when they were laid off early in the pandemic and then got back to work. An employer, they may fall within the scope. Marketplace applicants this year will also be given more time to submit documentation verifying their income. This data is automatically checked through sources such as the IRS and Social Security. But if income cannot be verified, applicants are normally asked to provide the required information within 90 days. This year, people will have up to 150 days to submit this information. New automatic re-enrollment policy. Those currently enrolled in a plan who do not take action to renew or change their coverage will be automatically re-enrolled on December 16 in most cases. This has always been the protocol of ACA plans, but it usually means a person re-enrolls in the plan they are currently using. This year, process will be a little different, with health.gov checking whether enrollees in bronze plans, which have the lowest monthly premiums, are eligible for cost-sharing reduction plans at next tier. Silver. Deductibles and out-of-pocket costs are generally lower for silver plans than for bronze plans. Eligibility for cost-sharing reduction plans includes those making incomes at or below 250% of the federal poverty line. They tweaked the algorithm this year to make sure as many people as possible get all the benefits they deserve. Sigh.